Hey gang, welcome to another episode of Rotator Cuff Expert. My job here is to try and help explain and help you get through the difficulties of rotator cuff repair or rotator cuff tear or even just shoulder pain. So today we're going to talk to something that is important. In the last few videos we talked about things that can affect whether or not the rotator cuff will heal, and today we're going to talk about smoking. Specifically this study by Zhang, Z-A-N-G, Journal of Shoulder and Elbow Surgery. This was back in 2021. They looked at patients and the increased risk of re-tear, or what I would consider non-healing rotator cuff. We know that cigarette smoking or nicotine or any kind of nicotine product is detrimental to our health, right? We know that it's bad for our heart. We know we can increase risk of heart attacks and strokes. We know there's lots of other things that smoking can do besides just lung cancer. Today, we're going to look at what it does or what it can potentially do for rotator cuff tears. We have talked about what a meta-analysis means. Meta-analysis means it's a study of studies. So we get a whole bunch of studies together, and those whole bunch of studies, we study them to get more power, to get more statistical significance. Not easy for me to say, obviously, to figure out if this is important, right? And so this study looked at people who had a rotator cuff repair, either open or arthroscopic, because it probably doesn't really matter as long as it's been repaired. They might matter in other things as far as pain and stiffness, but it doesn't really matter as far as the actual repair itself. So they looked at that, and they looked at whether there was a smoker or not smoker, right? Those, if the studies identified that population, then they can use that study in this study of studies. The study had about 65,000 non-smokers and about 8,500 smokers. And so this is important because that's a big number, right? And we already know, obviously there's much less smokers than non-smokers, which I think says something about our society and what who smokes and who doesn't smoke, and how many people are smoking in that age of life where you'd have a rotator cuff repair. But it's important, and when we talk about the meta-analysis, it's important that we are able to do meta-analysis, because that allows us to get the power, right? If we had one study that we had 100 non-smokers and 3 or 4 smokers, we may not be able to get the information that it's clear enough to have power to say this is probably true. This looks like that it's important enough. Whereas if you had 2 or 3 and it looked like that, it's hard to have a statistical significance in that. And there are certain scores that you can use, certain tests, certain questionnaires after rotator cuff repair to see how people are doing. Almost all of those tests, all those questionnaires were exactly the same between a smoker and a non-smoker. So that means early after surgery, the symptoms were the same between smokers and non-smokers. So that gives us an idea that probably the repairs were done of reasonable quality, right? It's not as if one did poorly and the other did a great job. So it's really important in this study that we have a baseline. When we looked at the rate of re-tear, when they do the statistical analysis, the rate of re-tear, or what I would prefer to say, the rate of non-healing, because that's typically what it is. If you can imagine, if you have a rotator cuff that attaches to the bone, we already know this bone has poor blood supply. That's why the rotator cuff heals anyway, right? Has bad blood supply. And so we do a whole bunch of stuff to try to get the rotator cuff to heal back down. We encourage that blood flow to get back there. So we already know that the blood supply is not very good there. And if we take nicotine, which is probably the reason why we have these non-healing or re-tears, the nicotine contracts blood vessels. So we contract blood vessels going to an area where you really need dilated blood vessels in that bone, in that body to heal. If you have contracted or constricted blood vessels, not allowing the blood to get to a place where it's going to heal, it would make sense that it's not going to heal. That's part of the reason why people who smoke have delayed healing in other wounds. So when we look at this, 2 times more likely to have a re-tear or a non-healed rotator cuff in someone who smokes. And this is important information, but in general it's important. If we're really talking about nicotine, and probably we are, then if you use a patch, or if you vape instead of smoke, or if you chew instead of smoke, it doesn't probably matter, right? Although it may be better for your lungs if you use your patch, it probably doesn't actually help your rotator cuff healing. So that's really important to know. So that means if you're going to have a rotator cuff repair and you have some time between the diagnosis and the surgery and you smoke, it would be really important for us to get you on a plan to decrease the volume at least, right? Decrease the amount of nicotine given in your body, and ideally to make it zero, but at least decrease it. So we help these odds. We decrease the 2 times more likely to re-tear. So super important. If you know someone who smokes or you smoke and you're getting ready for rotator cuff repair, it's important to know and talk to your doctor, whether it's your primary care doctor or your surgeon. Try to figure out a way that you can decrease that nicotine load before you have your surgery. Thanks so much for watching. Hope that you enjoyed this. Hope this was useful for you. Please like the channel. Please subscribe to the channel. Please use the alarm to know when we're going to do another one, because we try to do this about once a week. So hope this helps, and we'll talk to you soon.